Thank you for that introduction. It's a pleasure to be here today. About 5 years ago, my son-in-law had shoulder surgery, and he was sent home with pain medication. After 3 weeks of taking the pain medication appropriately, as prescribed, he was addicted to the pain medication. Thankfully, it only took him a few more weeks to kick that addiction, but not without some trauma to him and his family. I've got a personal interest in the opioid crisis. And then about 2 years after my son-in-law's surgery, his daughter, my granddaughter, went in for surgery on her leg. She was sent home with 100 OxyContin tablets. 100 OxyContin tablets for an 11-year-old. I was incensed. Thank goodness she didn't need any of the tablets. She took Tylenol, and that took care of her pain. Did I tell you I have a personal interest in the opioid crisis? How many people here know somebody who's been affected by the opioid crisis? Yeah, a few of you, sure. Fortunately, there are solutions to the opioid crisis, and that's why we're here today. At the end of 2017, there was a white paper that was written that can help us sort out this mess, and we're going to focus on that white paper today. White papers are designed to help us understand complex issues, and this white paper does a great job of that. You may have seen it because it was published, it was reported on in the Seattle Times in 2018. So let's see if you remember this white paper. The white paper was titled, Evidence-Based Non-Pharmacologic Strategies for Comprehensive Pain Care, the Consortium Pain Task Force white paper. Anybody here remember it? No? Okay. Well, that's par for the course. There are 3 words I'd like to focus on from this title. The first is evidence-based. So this title says these are research-based strategies. The research has been done and found to be good, and we're going to go ahead. Perfect. Non-pharmacologic. Non-pharmacologic means non-drug. And the third phrase I'd like to look at is comprehensive pain care. What that means in this setting is inpatient pain and outpatient pain, or acute pain and chronic pain. The authors of any paper are important, and certainly a paper like this. For instance, if you were reading a paper about the future of computers in the United States, and Bill Gates wrote it, you would say that paper has credibility based on the author alone, right? Bill Gates has credibility. Okay, so an author of a paper gives credibility to that paper. So let's see who this consortium is and see if they have any credibility. Here is a description from them of themselves. The Academic Consortium for Integrative Medicine and Health, the consortium, is a 72 North American institutional member organization of esteemed academic medical centers and health systems whose mission is to advance evidence-based integrative medicine and health in research curricula and sustainable models of clinical care. Again, as you might guess, there are 3 words or phrases that I'm going to focus on from that description of themselves. The first is esteemed academic medical centers. So in a minute or so, we're going to see another slide, and it's going to have some names of those 72 members of this organization. And so you're either going to say to yourself, wow, these are esteemed academic medical centers. Maybe I should be paying attention to what they're saying, or not. So we'll get there in a second. Evidence-based. One of the things that the consortium knew, and they said in their paper, was that although their opinion was extremely valuable because they are esteemed, research-based strategies were highly valued more than an opinion. Their colleagues in the field valued research-based strategies. That's why they made sure only research-based strategies were in the paper. Integrative care. Integrative care is essentially the combining or the collaboration between conventional medicine and what I call natural therapist, or you could call alternative care. So who were these authors? Who are the people that wrote this paper? Well, I'm going to name a few here call out a few, and you can read some of the rest. These obviously are not all 72 of the members, but let's see if you think they're, esteemed academic medical centers or not. We've got Scripps, we've got Cedars-Sinai, Yale, Northwestern, Johns Hopkins, Harvard, Mayo Clinic, Duke University, Cleveland Clinic, and the one that sticks out in my mind from Canada is McMaster University. Oh, I don't want to miss the University of Washington because that's where we are right now, in the state of Washington. So, are these esteemed academic medical centers? Should we be paying attention to them? Yes. Obviously, we should. So why did they write this paper? Well, obviously it has something to do with the opioid crisis. They had many reasons in their paper, and I'm just selecting out 5 of those. We're going to look at those right now. The first is the U.S. prescribes 50 times more opioids than the rest of the world combined. You know what I'm listening for? I'm listening for your jaws to drop and hit the floor, because that's what happened when I read that. 50 times more than the rest of the world combined. Can there be any good reason for us taking 50 times more opioids than anybody else? Second, the strategies are underutilized. So they've found these strategies to be valuable, and they want to promote their use, so they put them in the paper. The therapies are safe and effective. It doesn't get any better than safe and effective as far as a healthcare intervention goes. The strategies can be used as standalone by themselves, or they can be used in combination with conventional medicine. There's a place where everybody's happy. Standalone, by themselves, or in collaboration. The costs are nominal compared to the medical costs of treating chronic pain. Costs are always important when you're talking about any healthcare intervention. There are millions of people right now in the United States who are not taking their medications because of costs. So costs are nominal is a very important factor. So what are those strategies? First, we'll look at inpatient acute pain strategies. Acupuncture, massage, nice. Mind-body interventions such as music therapy. So you're telling me that I can play my rock and roll and it'll help me with my acute pain? Well, they're not exactly saying that, but remember, these are research-based strategies. And so music for acute pain is a big yes. Transcutaneous electrical nerve stimulation, TENS. How many people have used a TENS unit? It's usually a little black box, it's got wires sticking out of it, you put it on your body. It's a pretty common treatment for acute pain. What about outpatient chronic pain? Well, look at that. The first 2 are the same ones that were in the acute pain strategy list. And in fact, those are the only 2 that are in the acute pain list and in the chronic pain list. Now that doesn't mean those are the only ones that are going to be in the acute pain list in the near future, because remember, these are research-based strategies. Some of these other chronic pain strategies for a chronic pain are probably eventually going to end up into the acute pain category also. But right now, based on research, those are the only 2. Chiropractic and osteopathic care. Okay, what they're talking about here is manipulation. Now, I was a chiropractor for over 20 years, so I know a little about manipulation. When we graduated from chiropractic college and when the osteopaths graduated from their school, we were both trained and skilled in manipulation. But a deviation happens after that. Things change. When chiropractors get out into private practice, they typically continue to practice manipulation. And that's not so with osteopaths. Osteopaths tend to go the medical route and do very little, if any, manipulation. Therefore, if you're going to choose somebody for chronic pain, if you're going to choose manipulation, I think you better choose the person who has practiced. Physical therapy, mind, body, and movement therapies. What might those be? Movement therapies, yoga, yeah, Tai Chi, right? Cognitive behavioral therapy. Well, that's a mental health approach, so you're probably going to need a mental health therapist and specialist in that case. Right after the list of the chronic pain strategies, the white paper had a sentence and it said, referral is recommended. So in other words, if you're in the hospital and you're going to have chronic pain when you get out of the hospital for whatever reason, the person who refers you or who discharges you from the hospital should have a referral list for you to use. And what happens if they don't? Well, if they don't, they're not practicing the best medicine. It's not surprising that many, if not most, of these institutions have incorporated these natural therapies into their health systems. And in fact, they use these natural therapies for the benefit of their faculty, staff, and students. So let's see what Harvard University is doing. Harvard University, Faculty of Arts and Sciences. Who is this for? It's for all members of the Harvard community. And who's that? That's students, faculty, staff, retirees, and university affiliates. That's pretty much everybody. Can take advantage of the innovative programs. Innovative programs. So what are those innovative programs? Well, look below. Yoga, meditation, acupuncture, massage, and Reiki. I said it's not surprising that these institutions, these esteemed academic medical centers, have incorporated these natural therapies into their systems. And it isn't surprising, because they wrote the paper. They're paying attention to what they wrote. Okay, it's pretty simple. But it's not surprising, but it is amazing, because these institutions are huge, and large institutions don't have a reputation for rapid change. I used to work for the largest health insurer in the United States for the last 13 years of my healthcare career, before I retired. Rapid change didn't happen unless something monumental occurred. This white paper that we're talking about today is monumental. Now, unfortunately, most of us don't have access to these esteemed academic medical centers, do we? We get our health care locally, unless you're really wealthy and you can travel back and forth, pay a lot of money. We get our health care locally. We have skilled conventional medical doctors in our community. We have skilled natural therapists in our community. But what does the white paper say is the best care for pain? Collaboration. Collaboration of those two healthcare provider types. Is that what you're receiving in your community? If you want to find out what the best optimal care looks like, you can have it in your community by doing something. And what you can do is you can talk to your conventional medical doctor, your family doctor, let's say, and tell her about this white paper that we talked about today. If she doesn't know about it, I'm going to hand out an information sheet at the end of the presentation, and you can give her that information sheet. Not only that, but also give her the names of the natural therapists that you use in the community, that you use and you trust, because she's going to want somebody to refer to. So if your family doctor starts referring patients to the natural therapists in your community, you're going to find that you and her patients are starting to receive the optimal care, the best care possible for whatever ails you. And I said for whatever ails you. I didn't say just pain. I said for whatever ails you, because guess what? These esteemed academic medical centers are collaborating for many things other than just pain. And if you want to find out what else you're missing besides these pain therapies, when I hand out the information sheet at the end of the presentation, give me your business card, and I'll email you the first half of my new book. You can see it right here. Rise of the Natural Therapies, First Do No Harm. In the first half of my book, I identify all of the illnesses and diseases where collaboration is taking place besides just pain. We're fortunate in this community, aren't we? Because we have skilled conventional medical specialists, and we have skilled natural therapists that we can go to. But what are you receiving? Are you receiving optimal care? Are you receiving collaboration? Why settle for anything less? And what about the rest of the people in your community who can't access the best health specialists or the natural therapists? If you connect your family doctor, let's say, with your acupuncturist, let's say, you're going to find that many people in your community who would have become addicted to opioids won't become addicted to opioids. That's why you're a key player in the opioid crisis. Thank you very much.